Dennis, hello. Okay, I think we're live now. So I'll start chatting then, should I? Hello everybody. Welcome to this live stream seminar event as part of the virtual I&I program on the infectious dynamics of pandemics, if I've got my words in the right order. I'm David Abrahams. I'm the director of the Isaac Newton Institute, and it's my great pleasure to sort of kick off this formal part of the day's workshop, which is part of a 4-month virtual program. So I'd just like to say a couple of words to thank everybody who's been involved in the setting up of the program. It's taken a lot of people working very hard in a very short amount of time. So the Institute's been running for about 27 years now, and its job is to further mathematical sciences research across the whole gamut of the subject, from the very pure to the very applied. And we run large programs, so typically 4 or 6 months long, with many workshops and incorporating many people involved in the running and audience of these events. It means that because they're large activities, they usually take 2.5 or 3 years to construct. This one has been constructed in about 3 weeks. And the scale of all of our programs is such that they are there for the long term. The Institute makes a difference over decades or centuries even. But we see this event as being something that could have a very, very profound impact. And it has a unique role with a large participant base of making a difference with all of the activity that's going on around the world within infectious disease modeling. So I think we have a special angle, and hopefully we will have the resource and the ability to put on a program which is as close to being a physical program based in our building as possible, but being run virtually. And over the months, we may feel that we can actually do a better job than we've been able to do in the past and learn something. But I just want to say thank you for being participants. Thank you if you're listening to us via live streaming. And I hope in time that we will get more able to put on events at the drop of a hat, and you will get more information as to what we're doing. So we'll keep you posted, but by all means, drop me an email, or Deirdre or Valerie or Dennis, the principal organizers of this event, in coming weeks and months. So thank you. With that, I'll just thank our speaker, Graham. I'll thank our principal organizer, Deirdre, for working so hard with the rest of her team to set it up, and I wish you all success with the program. So over to you, Deirdre. Thank you.
Thank you very much, David. And I really, on behalf of the organising committee, I would like to thank David and the Isaac Newton Institute for stimulating and hosting this programme, and also for being so hugely supportive, as you described, in getting it off the ground so quickly in this virtual way. As we know, for COVID modelling, infectious disease modelling has rarely been so prominent in public consciousness. And therefore, alongside all of the very hard work that's been done modelling coronavirus, it was important that the Isaac Newton Institute provide a space and time for modellers to think about the broader questions. And as you mentioned, looking forward, how can we learn from this current situation for future pandemics, but also that this is an opportunity to bring in other expertise into our field from a broad range of different scientific and social science areas. And that's something we're looking to address over the next few weeks. However, the real hot topic is how modelling can inform policy in real time during this pandemic. And with that in mind, it's a real pleasure to introduce our opening lecturer, Professor Graham Medley from the London School of Hygiene and Tropical Medicine. He has a very broad track record in modelling for policy, and that was why he was selected as chair of the UK's main policy advisory group on modelling, SPI-M as it's called. And he has used his chairmanship of that board to sort of manage a diverse number of modelling groups and provide his really unique insight on the role of modelling for policy. So without further ado, I'm going to hand over to you, Graham, and thank you very much for your time, and we'll look forward to your thoughts on the role of modelling in the current pandemic.
Thank you very much indeed, Deirdre. So I've got some slides. I haven't had an enormous amount of time to prepare this talk, so I apologise in advance for the fact that I don't really know how long it's going to take, but we'll see how it goes. And I believe that somebody is going to put the slides up. Thank you very much. So I'm going to say something briefly about the current situation. The COVID-19 epidemic is still very new. It started, as I think we all know, in China late last year, and has grown now to be a pandemic and infect the whole of the world. Largely, I'm going to focus mostly on the UK because that's where I know most about. But what is happening in the UK is being replicated elsewhere as well. So I am the chair of SPIEM, this enigmatic committee. The SPIEM is stands for Science Pandemic Influenza Modelling. And when I was invited to chair this back in 2017, I do have to say that one of the reasons that I was interested in doing it was just because of the name. And one of the members of the Secretariat offered to hum the James Bond theme tune every time I started chairing a meeting. The main point of that committee in between pandemics is to prepare for the next pandemic. And so we already had quite a good idea. Other members had lived through different pandemics. So we already had quite a good idea of what would happen. But of course, in the theory is very different from the practice. And I believe I should be able to change slides, but I don't quite know how I can do that. If I say next slide, can that? Thank you very much. So my short-term forecast for this talk is that I'm going to say a little bit about how the policy science interface works in terms of modelling for COVID-19 in UK at the moment. A little bit about what modelling for policy entails and the role of modelling. I'm going to spend a little bit of time just thinking aloud about what model structures we're missing. What is it that we would like to have done in between the last pandemic and this one? And then a word or two about where I think we are in terms of the epidemiology and where we're going. I'm not going to go into the disease details. There is a very good lecture by the Chief Medical Officer, Chris Whitty, available on YouTube, which some of you will find, and we can put the link, which is a very good summary of our current understanding of the epidemiology, of the clinical features of the disease. And I'm not going to go into those. I'm going to presume that you all have some understanding of the basics of COVID-19. And as he says at the beginning of his lecture, we know that this disease is so new that the things that we think we understand now are going to be wrong. So I'm undoubtedly going to say things during the course of this lecture which turn out to be untrue or potentially misleading, which I can't and I won't apologize because that's just the state of what happens during pandemics. Oops, I want to go back. Thank you. So this is how the modeling is organized. So SPIEM has now become SPIEMO. So when SAGE is set up, SAGE is the Scientific Advisory Group for Emergencies. When that's set up, at the beginning of a pandemic, SPI-M, which normally reports to the Deputy Chief Medical Officer in the Department of Health and Social Care, gets transferred to be a subcommittee of SAGE. And SAGE, as you know, has the government Chief Scientific Advisor, the CMO, representative of PHE, Public Health England, Office of National Statistics, etc., all on that committee. And SPI-MO feeds into that committee. And as the chair of SPI-MO, I sit on SAGE. Various other subcommittees feed in. So NERV-TAG, which is expert in the virology. We now have a hospital onset group, and SPI-B, which is looking at behavioral aspects, all feed into SAGE. And our job on these subcommittees is to develop the evidence. So we're looking to gather the scientific evidence to present that to SAGE, and then SAGE uses that to create the advice which goes up through the civil service, eventually to the ministers who make the decisions. SPI-MO has got representatives. There was a meeting this morning. I think there are of the order of 60 people on those calls. Not all of them are participating actively. Lots of people listening across government, quite rightly, to find out what it is that we think of the evidence and the strength of that evidence. And this listed there are the names of the organizations that people join us from, and the names themselves, apart from two who've declined not to be named, but the names themselves are available on the Go Science website if you want to see who they are. But they are a fantastic group of people who've contributed a huge amount of time and effort in order to generate this scientific evidence. And one of the things I'd like to do in this lecture is to acknowledge the role of Bob May in development of this subject, but also in development of understanding of the way in which science and policy should interact. And we can remember Bob May in two ways. One of his contribution scientifically and to policy, which was huge. But then we can also remember him in terms of the numerous anecdotes that he's left behind. And one in particular strikes me as I look at this list, which is that somebody had once said that you should always try and collaborate with people who are more intelligent than you are. And Bob May apparently said, yes, well, that's easier for some people than others. And in this case, it's extremely easy for me because the talent and the expertise on SPI-MO is outstanding. Makes my job a lot easier, makes my job possible. Of course, as soon as the pandemic starts, and especially as organizations such as universities begin to close down, there's an awful lot of very clever numerate people who are left wondering what it is possibly that the modelers could be doing that could take them so long to produce modeling evidence. And I and others received lots of emails during that period of time, sort of during March, from people who, for example, were running large, complex, individual-based models who would send me an email saying, what you need is a large, complex, individual-based model to solve the problem. This is something which I thought, well, then we need somehow to channel this talent. And so I was very happy to get a call from Mike Katz at Cambridge, who said, would it be sensible to set up something, a channel for this talent? And so RAMP, which many of you will know, set up by the Royal Society, has been a fantastic organization, enormous support for the members of SPI-M in finding people with particular levels of expertise to join in. And we are continually looking for ways to make the routes to which we can expand the input into creating the scientific evidence to help manage COVID can feed into it's been hopefully something that will continue to grow. So we know at the beginning of any pandemic that we're facing a virus for which we have very imperfect information. And we're expecting that information to develop over time, initially slowly, but exponentially. The data accrues exponentially. But it's because of that gap where we don't know what's going to happen, we don't know necessarily what is happening, and yet policy has to be made, that we have this uncertainty in what it is that should be advised. So modeling becomes extremely important in that gap, because it apparently creates the evidence that people need to think about to make policy. Now, because of that, in the preparedness document that SPI-M has produced, we kind of lay down the basic principles of what we need to do during the early stages of a pandemic, because in that period of great uncertainty, I don't want to use the word panic, but there is a lot of people running around saying, well, we've got to do something, we've got to do something. And so there's a kind of rule book, a playbook, if you like, of, no, this is in that period when we don't know what to do. Modeling will be impossible, because we won't have detailed data on what COVID does in the United Kingdom. We saw it in other countries on the way in, but we didn't know what it was going to do in the United Kingdom. We didn't have those data streams that we knew we would have. And so in that period of uncertainty, we'd like to do the modeling beforehand, before we can actually start to address specific policies. When we do start to have data streams, and we do start to understand more about what the disease is doing in the United Kingdom, then models play this central role. They sit between the data and the policy. So models in this sense are really no more than data interpretation tools to be able to say, well, what is it that's going on? What is the estimate of the basic reproduction number? What is the estimate of the doubling time, which we can gather from the data? And then that feeds into discussions about what you're going to do about it. One of the things that we didn't write down, which I think is now becoming very apparent to me, is that we are where we are. And in terms of the early stages of the epidemic, there's no point in looking back and saying, well, what if we'd done this? What if we'd done that? Not to say that other people shouldn't do it, but I think in terms of people who are actually working with the data and working in terms of deciding what it is that might be done tomorrow, looking back to say, well, if only we had done something different, isn't particularly helpful in that process itself. The other thing we know about pandemics and you know, the number of pandemics we've seen, starting with HIV in my case, so that was my first pandemic. We know that novel pathogens, if they're going to be successful and to establish themselves and to spread to many countries, many populations, they will find new heterogeneities or novel combinations of old heterogeneities in which to propagate through the population. Core groups are always important, and they're perhaps essential. So a core group is those people who are more likely to be infected and more likely to infect. And you kind of, I think I'm kind of making this up as I go along, but I think that for any infectious disease to be able to propagate into a population, to be able to become a pandemic, it has to find core groups. It means that R is always bigger at the start of an epidemic. So the basic reproduction number, which is a measure of the average number of secondary cases from each primary case, is always bigger because the infection goes through those core groups initially. But core groups will change. So we have to watch that during the course of the epidemic. R will change because of the different groups are getting infected at different times. And the infection is always going to find, eventually, when if it becomes endemic, but even during the epidemic phase, what somebody once called the dim corners of society. So those people who are less easy to intervene on and less easy to discover what's going on in terms of the epidemiology and less easy to control for whatever reason, those are going to be especially problematic. They're going to be, to some extent, a core group, and to some extent, far less easy to manage. The biggest surprise, though, of this disease, this pandemic, has not been the fact that this epidemic has found different heterogeneities and different combinations of heterogeneities, and has found its way into groups with, in this case, the highest deprivation or the lowest socioeconomic status. That might have been expected. The biggest surprise so far of this pandemic has been the public health response. If you look at the SPI-M preparedness document, nowhere does it talk about lockdown, nowhere does it talk about a nationally coordinated reduction in contact rates, aside from closing schools. And as you know, a much overused word, but this really does have no precedent nationally, let alone to be repeated globally. And I'm guessing at some point in the very recent past, pretty much every school in the world was closed as a response to COVID. And this is why. This is what we know about, or something in what we know about the way in which respiratory diseases are spread. Kind of theory is really very much centered around households. So households represented by those boxes across the middle of the slide. So one of the things that we haven't done in the UK, although they have done in South Korea, is to break up households. So during this current period that we've been in, we've asked people to stay at home. In other countries, people who are infected have asked not to go home. We haven't done that. Home we regarded as being the place within which transmission occurs. And so what we're interested in then is breaking up the transmission network between households. You know? And those are really principally kind of three routes. We know that people will pass transmission at work. And so work transmission goes between work colleagues back to different households. And we know that transmission occurs in schools, so that transmission passes from household to household through schools. And most of the models that we have, all of the models that we have, represent that kind of network really very well. Yeah, the work, household, school is that those kind of layers are really very well understood. And as I said in the past, we've known most about how to break those networks by closing schools. Yeah, so that closing schools is relatively easy. It can be done relatively simply. And of course, if you close schools, then people can't go. So it kind of circumvents a lot of the behavioral aspects. And if you close schools, then a lot of people who would otherwise go to work can't go to work because they have to stay home and look after their schools. So it's a very effective way of breaking up networks. But I don't think anyone has ever suggested that we close work to break those networks before. We also know that people spend a lot of their time in leisure, and there are three bars on the bottom right-hand side of that screen, sort of showing what people do in their leisure time, some aspects. And I think I'm right in saying that none of the models that we have include any of those explicitly. We know that what proportion of time people spend in these leisure activities, gyms or bars or personal care, which including hairdressers. So we know that people do go to those, but we don't have any really very good data on the networks that those activities create, how they relate to different households, how they relate to different workplaces, and how they might relate to schools. And that degree of those correlations of degree and those kind of close networks that are formed are going to be very important. And our experience of looking at overseas what has happened in other countries suggests that those activities, those leisure activities, are things that we really are going to have to kind of collect some information about and include those in this network if we want to get an idea of when, for example, in the United Kingdom, we're going to be able to open pubs, then we're going to really have to understand how people might use them. The other group of three things that are in the top right hand of the slide, the hospital, social care and prisons, really sort of represents those institutions which, again, we don't really include very well in these networks. So in the current measures that we've closed down or tried to reduce as much as possible contacts that create these networks. Is for example, that in key workers, so those people whose jobs are regarded as being essential, including healthcare workers and social care workers, have not been isolated at home. And so that part of the network has carried on. But we don't know much about that part of the network. We don't know how much it interacts with each other. And likewise, there are large institutions like prisons, for which, again, we have very little understanding of the networks that they create, both internally, but also externally as well. So again, they're structures that are missing from the current models. What we do know is that in the future, in terms of how we go from the situation we're in now to kind of rewiring these networks, is the thing that is going to have to be done very carefully. So we know that we have these kind of 6 degrees of separation, that what we're trying to do is to as much as possible allow people to go back to school and allow people to go back to work without creating some huge giant component that allows the virus to be transmitted in a few jumps to everybody, a few chains of relatively short length to everybody in the United Kingdom. So in terms of the next pandemic, one thing I think we would like to be able to hand on to the kind of next generation of modelers is a really good theory about dynamic networks. There's quite a lot of good theory about static networks, but some really good idea about how networks get changed and created in real time, and networks that include place as well as contact. So it's again, I think, relatively clear from looking at the epidemiology of this disease is that place is just as important, and the setting and the environment of that place, as the contact. And so some networks theory that includes places where people go and make contact in some dynamic framework, and I'm not a mathematician, so I'm not capable of kind of putting that into mathematical modeling requirements, but dynamic networks I know is something we can really do with. A lot of discussion about the geography. Do we need geographically specific networks? And I think we will, but just as important as the social geography, if you like, the fact that personally I have more connection with sort of towns where I have friends and relations living that might be 60 or 70 miles away from here than I do with the local town, because I'm making contacts with those people preferentially. Then the social aspects of these networks, I think, is probably just as important as the geographical aspects. So as these networks get rewired in the coming weeks, the geography is not going to be necessarily as important as this kind of social geography, if you like. We're moving into a phase in which the numbers of cases is reducing. In the kind of the past 2 or 3 months, we've been thinking about models in terms of their kind of very deterministic models, mass action models, things happening very quickly with large numbers of cases. If we're successful in maintaining a reduction in transmission, then we're going to move towards a situation where stochastic effects are going to be much more important. We're going to be looking at outbreaks rather than a sort of large-scale epidemic. Then we're going to be worried again about this social geography. So where are these outbreaks going to occur, with what frequency, with what size, and as I say, across the kind of social geography. In this process, we are of course worried very much about data. Where are we going to get the data from? What's the source of that data? What is it that we should be measuring? And so I think the kind of adaptive management approach, or the value of information approach, is going to be increasingly important. It would be great if we could use the modeling to be able to say to Public Health England and other people, right, you have this number of tests, or you have this capacity to be able to collect this information. This is the information that's going to be absolutely crucial in the next coming weeks. So go and collect that data above all else. At the moment, we're having to do that, but we're having to do it by making educated guesswork and intuition and experience, rather than being able to do it in some kind of semi-formal way, at least, to be able to then know what we're going to do with that information. And of course, as always happens, when you gather some data, all it does is tell you how you should properly have gathered it, and what other data you need. And some way of knowing that pathway through the epidemic, I think would be extremely useful to the next one. The other thing, although there are people who very ably considered real time, doing things in real time, it is something which deserves more thought. We're using models to try and address a current problem, and I'll say a bit more about the time constraints of doing this for policy, but it really has to be done in real time. And that is itself an art, because what you have to face is the fact that reporting delays, again, something which was very important back in the world of HIV, and I thought would largely have been addressed. But they are a huge issue in terms of understanding what it is that's going on now, rather than what it is that was going on last week or last month. Likewise, missing data. Although the data streams are working, although people understand the importance of the data, nonetheless, you're asking people to collect data in the face of a very large epidemic. So many of the data streams immediately are missing. You know, when data, for example, is coming in on patients, then age, basic information such as age, occupation, whatever, is often missing from those data, quite reasonably, because the people in the intensive care unit are more worried about saving the life than they are in filling out the form or entering the data properly. Again, that's really something which you can foresee happening. So some way of thinking about that, either better and more efficient way of gathering the data, or better ways in which we can deal with the missing data, I think would be, is again something that needs careful attention. Viral genomics are going to be increasingly important. There's something which I know a lot of information being covered, a lot of thought being given to it, but I'm guessing that there can always be more. And then finally, just in terms of thinking about what models are going to be needed, and what we don't really have is this way of being able to think about or measure dynamic networks as they're being formed. And to some extent, this is just as much a problem in data gathering as it is in terms of model structure. There are various ways in which people are thinking about gathering data, but because it's all being done in real time, people are designing the studies, and designing the way in which data are going to be analyzed as we're going along, it's going to be very useful and very important, I think, to look at that process and look to see what we end up with, and inevitably to be able to look back and say, well, this is the way we should have done it. Let's do it that way next time. So modeling for policy is something which I have been involved in for a lot of my career, but I've never done it in this kind of intensity. Of course, what you need to do is to remember that you're focusing on a given question to a large extent. You do have some flexibility to be able to turn around to decision makers and say, well, that's the wrong question. But by and large, you're addressing a given question with whatever models and data are available. And often that means that you're not doing the best job that you know you could if you had more time, but you're trying to do a job which gives you the right answer, or not the right answer, gives an answer which is going to be potentially useful. You know, a half good answer given before the decision is made is as infinitely more useful than a perfect answer given after the decision is made. And that is, I think, something which generally people who are involved in academic science struggle to deal with, but it has to be done. Science and policy use completely different languages and completely different approaches to addressing decisions and addressing problems. So I find that a lot of what I do is translation, but I talk to people who are asking questions, not the decision makers, but the people who are kind of filtering those questions, to really work out what the policy question means in terms of something that can be modeled. And then when the model is, modeling has been done, is then to help them convert that back into something which can be understood by policy. A lot of that time, that means just translation of words. And so originally we have the non-pharmaceutical interventions, that got changed to social distancing, and then became behavioral and social interventions, but by and large they're now called lockdown or current measures as a shorthand. And the reason for that kind of progression through different acronyms or different names is partly is trying to find a common language between the people setting the policy or advising the policy and the people who are working on the scientific background, is to just develop that common language between them. I'll miss out that. So then the other issue is the time periods. There's again this rapid time period, deciding which populations we're dealing with, what the scope of those questions are. And so one of the words that I've come across which I hadn't, but I have done in the past couple of months, is something called a battle rhythm. So the battle rhythm is the idea that you create a chain that can go from evidence to advice to decision making in a way that is coordinated rather than chaotic. And this has taken some time to sort out. You can imagine that in the early February that as SPI-M was being stood up, as SAGE was being started, as civil servants were being brought into those secretariats and introduced into the process, that there was inevitably people who arrived in an organization in 1 minute and then sort of next minute were being handed responsibility for developing something. Getting that battle rhythm is actually critically important into getting all of these different disciplines and different spheres working together to produce the necessary decisions and the necessary action. So as far as SPI-M is concerned, we receive commissions from the government, various arms of government. We then have to translate those into modelable problems that gets then devolved out into the different members of SPI-M who offer to do it. It then comes back and we agree a consensus. So SPI-M works by agreeing a consensus, what it is that we think the evidence is. And there is a language around how to express that as uncertainty. So making sure that when we think something is highly likely and we sort of convey that to SAGE as being something that we think is highly likely, that we all know what highly likely means, and the certainty with which we hold that view. All that language has to be agreed. That then goes to SAGE, and I and other members of SPIAM, I represent SPIAM, other members sit on of SPIAM sit on SAGE, and that is discussed, the evidence that we produce and turned into advice, and then that goes to back to government. Quite rightly, I think, and this is kind of set down as being a major part of the way in which the science policy is organised in the United Kingdom. That evidence that we produce is essentially public, and so the documents that we produce are public, and we encourage members to publish as much as possible their work. But then the advice that comes out of SAGE and goes to ministers isn't public, and I think that's quite reasonable that the decision maker ought to get the first bite of the cherry, if you like, rather than read what the advice is in the media before they've seen it any other way. So that process, I think works by and large, and I think it has worked throughout. So just a couple of slides about where I think we are. So we have essentially at the moment, two dynamic regimes we can be in. One of the things about this pandemic, which I think has been quite remarkable, is the fact that this reproduction number, even though it's miscalled a rate, but it is a number, as Bob May would have said, the reproduction number has become something which I think many people in general population, and certainly the media, like to worry about, and quite rightly so, because if that number is bigger than one, if each case gives rise to more than one other case, we are in exponential growth, and we end up with a huge number of cases and deaths, which overwhelm the services, health services, and tragically result in large numbers of people dying of COVID. Or this number is less than one, in which case we will see an exponentially decreasing numbers of cases. What we haven't done to date, and poses a real challenge, I think, is to get across the idea that R being equal to 1 represents a neutral stability, so that whatever number of cases we have will remain at that level. So if we have 1,000 people infected and the R is 1, then the next generation will be 1,000 and so on. But that is true if we have 10 cases or we have 100,000 cases. I think I could foresee a challenge getting that across. We have also, those people working on household models will know that there's something called R star, which is essentially the reproduction number between households. And there's a next generation matrix that if you have two populations that you worry about, an R in one and the other, then of course you've got two other R's which represent the transmission between those populations. And so that's again another challenge for us to start talking about, I think, in the coming weeks. So the current situation, the prevalence in the UK is about 200,000 prevalent cases of COVID, and incidence, if you divide that by 10, just say, well, infection lasts around 10 days, then you end up with a daily incidence of about 20,000 cases, and we're in that kind of ballpark. The data are coming in to enable us to estimate those much more finely, but that's roughly where we are. And roughly about 10% of the population have already been exposed. So we're still very early in this epidemic. We're into this phase where the heterogeneity is going to become increasingly important. It's already there, but if we're able to keep basic reproduction number less than 1 for prolonged periods of time, then that heterogeneity will become increasingly important. And that's where we're going. If we keep ours below 1, then we're going to end up with small, increasingly disconnected subepidemics. If R goes bigger than 1, and it's government policy to try and keep it below 1. But if it goes bigger than 1, then it's very hard to see that there is any way backwards other than to imposing some kind of lockdown to break up those networks to try and reduce it again. But the end point is undefined. We honestly don't know where we're going on and how this whole thing is going to be played out. There are some people who will say that this disease will become endemic. On the other hand, there are countries which are moving towards elimination. So it remains to be seen. Thank you very much indeed.
Thank you, Graham. Lots of interesting thoughts. I wonder if we have any questions from the floor, from the participants.
We do, they come.
Brilliant. So one question, how much is known about networks during travel and shopping? How much do we know about people's behaviours and repeat behaviours in those kind of scenarios?
No, so I should have put public transport on that slide as well. I mean, it's again something which we know. We have some information in terms of we know how far people commute, but we don't have any. What we lack principally is those extra connections. So, you know, are there some schools where people will go on public transport to, or children go to transport to a lot? Are there some workplaces where people go to transport more than others? Are there distances where people will tend to go more than on public transport? So that's something, again, which information will hopefully accrue in the coming weeks. We'll understand a lot more about that. Shopping, again, that's something which is, as far as I know, there's very little information in terms of in terms of disease control. On the other hand, there is an awful lot of information about shopping in terms of what people spend and where people go and why they go there. And so using that information is again going to be important.
Thank you. And then as a sort of a related question, you talked about core groups, which is kind of a concept that we're familiar with in epidemiology, the people who are driving the transmission or the contact patterns that are driving transmission. You mentioned that, you know, they're different in the early stages of an outbreak than later. What do you think are the main transmission groups at this point? And has there been a big change over the last few weeks?
It's a very good question. So at this point in time, as we are now, I think what we know is that a lot of infection is within the care home sector, and a lot of infection is within the healthcare sector. And so they are essentially the major groups of key workers who are still interacting with each other. And so they at the moment are the core group. And we've kind of forced them to be a core group by making everybody else stay at home. As people stop staying at home in the future, they will increasingly become less of a core group, but at the moment they are a core group. I think it's a very good question though, at the initial stages of the epidemic, so in early February in the UK, I don't think we know exactly who that core group was. And so we would need to, you know, potentially the serology as it starts to accrue will tell us where most infection has occurred.
Thank you, and thank you for this stream of questions I'm getting from the floor, so thank you for them. So could teachers who are contacting children of key workers at the moment act as sentinels to understand something about the role of children in transmission?
Yeah, so all the information that the best sort of information, another feature of pandemics or epidemics like this is that by and large you start with evidence that tends to be very anecdotal, and you know, as you're grappling around to know any information at all, the good anecdote does actually carry an awful lot of I beg your pardon, carry an awful lot of weight. And so that was the SPI-M Secretariat phoning me, I'll call them back in a minute, carry an awful lot of weight because of the lack of information. So a lot of the understanding that we have about the role of children has come from small studies or good anecdotes, but they do seem to be, the current understanding is that children are not playing a key role in transmission in this pandemic, unlike pandemic influenza, where we would expect them to be a core group and a key role in this. And that in terms of teachers, that actually data from Australia suggests that teachers are very good at transmitting to each other, but less good at transmitting to the children. So the staff room potentially is a kind of a bigger hub of transmission than the classroom. We're still watching that space very closely. The schools in other countries have started to return, and clearly we'll be watching those very carefully. I mean, countries are going to learn an awful lot from each other by watching each other, and other countries will learn a lot from us by what happens, what we do, and the consequence of it. The concept of using people as sentinels, I think, would be something that we would very swiftly pass on to SPY B, the behavioural subgroup, to be something to see whether or not that would, or how that would be accepted by the public potentially.
Thank you. And I wonder if you could talk a little bit about how the analytical results from SPY-M will be put in the public domain, or how that has happened, or how that may happen in the future.
So my understanding is that all the papers that we produce, and there are a lot of them at each meeting. I think the meeting we had this morning, we had something like 30 papers tabled. They will all get eventually released by SAGE, on the Go Science website. There, as you say, we encourage the SPY-M members where possible to publish, but we're working on this rapid turnaround for policy to actually sort of help decision makers, provide them with the evidence. That publication becomes quite difficult in that timescale, but eventually it will all be available, and the members of SPY-M are independent experts and are able to, output the information and the data that they have and the results that they have in any way that they see fit.
I'm just going to slightly interpret the question a bit more, because it seems like some numbers come out and immediately and others don't. So can you tell us a bit about which estimates get sort of taken forward and put in the public domain more quickly? And whether
I mean, that's really a decision for the way in which government wants to do it. Those numbers, as I say, the numbers that we produce as a SPY-M consensus get sent to SAGE, and then they are propagated through government. I think we are feeling our way through this whole process. I mean, I'm not really in a position to be able to talk about that process because I have no control over it. I just know what happens. Those numbers that we give to SAGE will eventually come out, but I appreciate that there is a delay.
Thank you. And I think we all appreciate how hard everybody's working on that panel. So I think it's just for people who aren't in those panels, just trying to understand what kind of things go on. And so I've got another couple of questions really about that kind of process. So what sort of things did the epidemic modelers take for granted that came as a surprise to policymakers? Do you have any examples of that?
It's a very good question. I think an awful lot. I think that the modelers on, generally infectious disease modelers have an intuitive understanding of the way in which the dynamics work, which is just not shared at all by other people. And I think that's part of the policy science gap, and part of the translation is that I can, use words and concepts which for me are third nature, and they meet with blank faces, so that that it's very hard to think of a specific example, because in fact it's a daily occurrence.
And I guess related to that, because epidemiologists have this understanding of the system from a sort of a more theoretical point of view, I suppose some would say, but how much scope do the panelists of SPY-MO have to recommend options or policy options that haven't been specifically asked in a question that's been put to them?
Yeah, that normally comes in terms of the feedback that we give to questions that we are asked to look at. So specific policies which we do model and we do address, and then feedback and say, well, that's the answer to this question, but actually a much better question is this one. I think that's, you know, a part of the proper process, that there is some kind of backwards and forwards. The trouble with it is that it is because it has to go up through government and come back through government, that process can often take a long time. So you do end up by actually creating a network whereby there are ways in which people throughout different branches of government can contact each other and contact me and say, well, we're thinking of doing this, what do you think? And then I can informally ask people around SPAEB and say, what do you think about that? And so try and shortcut and speed up that process. I think there's huge scope for it, but kind of informally rather than formally.
One more question I think about SPAEB process that we have here is what's the sort of forward-looking commitment in terms of open science and reproducible code, etc., accepting what you were just saying about how busy everybody is. You know, what are the sort of underlying principles you're trying to move towards, and what support do members of SPAEB need in that, and, or, you know, how's that?
So the work of SPAEB is supposed to be transparent and it's supposed to be open. Yeah, where the evidence is in the public domain, so that any delay in getting that work out is entirely caused by the fact that before you've done it, there are another 3 questions that are being asked. And so, but it is happening. I think most of the modelling groups now have at least have preprints, and many of the modelling groups have made code available and published onto GitHub. So that, and other code repositories are available, and so that yeah, that's the only kind of constraint for that is whether or not people want to do it, because sometimes you're asked to do little bits of analysis which are really unpublishable but contribute to the discussion and to the evidence that we produce. We try and make sure that we have at least 2 or 3 modeling results contributing to every kind of piece of evidence that we put forward, so that we're not just relying on one model. And sometimes that means that people are doing work which is essentially unpublishable in that form. But aside from that, it's really just the fact there are only 24 hours in the day.
Thank you. So a question about international collaboration. So how important will international collaboration be in helping us determine the long-term viable strategy? And importantly, do you think the long-term global strategy is going to be management or elimination, given the challenges around elimination and your experience working on other diseases like leprosy and neglected tropical diseases, thinking about elimination? So
that really, I think the question of elimination or management really very much depends on the biology of the virus and on the intervention tools that get developed. If the virus turns out to induce a solid lifelong immunity, then obviously that makes elimination much more likely than if it doesn't and reinfection is possible. And immunity is only temporary or partial. If vaccine is produced that is able to generate lifelong solid immunity, then again that puts it into an eliminatable realm. But I think that it's too early to say to what extent elimination or management is going to be the right way forward. I think that's something which we will probably be thinking about, you know, potentially later this year or early next year.
And what about the international collaboration aspect of that? You know, how have you seen that developing, or?
Yes, I think so. I mean, I think, in fact, what an Australian colleague said to me right at the beginning of the epidemic, in each country is going to find its own way through this, that each country has its own kind of cultural and regulatory backgrounds and social interactions, which means that there is going to be no one answer to this, that once we've gone into this situation where these non-pharmaceutical interventions or behavioral and social interventions have become the principal management tool that we have, they will operate in different countries in different ways at different times. So there will be international collaboration and cooperation in terms of trying to understand the epidemiology and hopefully doing the modeling as well. But I suspect that each country will have to find its own way through, you know, from now until whenever the end is.
Okay, I'm going to thank you for those thoughts. I'm going to finish with two questions. The first one is, what lessons can we take from the communication of pandemic models to the general public over the last weeks and months as epidemiological modelers or communicators of science?
It's a very interesting question, and I don't really think I can answer it because I haven't thought about it at all. I don't know. I think as somebody kind of, if you like, inside trying to communicate out, I'm probably the wrong person to answer that. But absolutely somebody on the outside who was trying to be communicated with has probably got a much better answer to that. Personally, I've found social media to be a combination of both excellent way of disseminating information and you know, a route into not some of the less pleasant sides of life. But you know, I don't know. I can't answer that question.
Well, thank you for trying. And then I'm going to ask you one more question related to.
I'm very used to saying I don't know. Yeah.
Yeah. So one of the other questions that I didn't ask you is, what's the biggest mistake that modelers make when their first interaction with policy? But I'm aware that we're running out of time, so I may ask you to maybe tweet about that later. But my final question.
It's just that failure to understand that the answer, you know, by 5 p.m. at the end of the day, which is half, you know, is accurate but very uncertain, is better than the answer that's 9 o'clock the following morning, which is much better.
And then linked to that, if we have 1 week with all these fantastic scientists and mathematicians working on a workshop this week at the INI, what's the one question you'd like them to work on?
Oh, the dynamic networks.
Yeah.
You know, the networks of places and people and contacts, and how those might get formed, and particular threshold danger points that we should be looking out for. You know, is there some warning signal that tells us when we're starting to get high sort of most of the people being drawn into the network, or large components start to appear? Is there some way in which we can evaluate networks from easily gatherable data?
Nice, easy question. Thank you, Graham. I'm sure we'll have that one solved by 5 o'clock tomorrow. Actually, the teams had already identified that this afternoon, so it's as if there's a nice segue between the two. So thank you very much. We'll keep you in touch with the outputs from the week. So I'm going to wrap up now because we're a little bit over time. So I'm going to say thank you again, Graham. We really appreciate your time and all those interesting thoughts, and for setting us some questions for the rest of the week. Thank you again to the Institute team for making this possible and all of their support and rapid turnaround on requests. Thank you to the audience for your attention and for the very good questions. And I think we'll wrap it up there and say good night to everyone, and thank you very much.
Thank you.